Welcome back. So, talking with children about their oral care and oral health, it's good to start at a very young age. And it's such an important topic because our teeth are, well, incredibly important. To talk to us about oral health and your kids, we have Dr. Phil Wenk with us today. Doctor, first off, thank you so much for joining us.
It's a pleasure. Thank you very much for being willing to talk about oral health.
Well, you're very welcome. So you're with Delta Dental. You've been in the business for a very long time. What's the first thing that I guess parents need to know about their kids' dental care? What's the very first thing?
Well, the first thing I think would tell them is that you start at a very young age, which you mentioned. That very young age is really about the time they first see those teeth start popping through the gum.
Okay.
Surprisingly, that'll run about age 6 months. And so you have to be kind of prepared. And the reason you're doing that, Stephanie, is to get the young person accommodated to somebody doing something in their mouths. So we would always encourage people, adults, children, with their children to start them early, start getting used to you using a toothbrush in their mouth and letting them see what it's like. The other thing is to remember, you should use a very, very soft toothbrush, and they're designed just for children. They're small in size, so you couldn't fit an adult-sized toothbrush in their mouths comfortably. And then the other thing I always did when I was in practice is recommending using warm water because it'll even soften the bristles even more. Some people even advocate early on using a clean wash rag to clean their teeth. Just to put their teeth between their fingers and scrub a little fluoride toothpaste on them to get them ready. You don't want to use a tube of fluoride toothpaste, but you want to use a little bit of fluoride. So number one, the fluoride effect begins because that's important. And then the second thing is, and probably the most important, is they get used to the taste. You don't use some mini, teeth brightening thing. Use the basic stuff. And they make toothpaste just for children.
Well, that is good to hear. What about how often do we brush, especially looking at like 6 months? Is that once a day? And then as you get into, I don't know, elementary age, do you brush more?
No, I think you would want to try to brush at least twice a day or treat them twice a day. So from the idea, you want to get them in the same habit that you want to be in yourself. And so if they see that you're brushing your teeth and they're 3 years old and they watch you brush your teeth, hopefully they'll say, okay, mommy or daddy, help me do that. And so you're accommodating them to that routine, and that routine's critical.
So we're brushing and flossing at home, but when's that first time we need to come and actually see a dentist? At what age do they need to take their child to see a dentist for the first time?
I always felt like somewhere between 2 and 3. And then what I would ask the parents to do is just bring the children in and just let them sit in their lap while the dentist did an exam or while the dentist was doing a cleaning. So the older they got, the more they got used to watching their mom do it. And then sometimes, and a lot of times, I never had any problem with this, after 1 or 2 visits like that, the child would want to have their teeth cleaned or brushed or whatever. And again, it's getting used to that different person doing the same thing that the parents are doing.
So say they're used to, they start going in and they still have that bit of a fear of the dentist. And I think normally it tends to be the sights, the sounds, the smells. How can parents talk to their kids to make them more comfortable?
Well, I think really the thing that worked better than talking to them, obviously, the thing that worked better was getting them in early and letting them get used to the dental office, because the sights and the sounds and the smells are going to always be the same in dental offices. You also have to get used to seeing people walking around in masks. That used to be even more uncommon than it is now because, pre-COVID, there were a lot of people walking around without masks. Mm-hmm. And suddenly we were all masked up. And so children saw people masked. But now, whole different story. People aren't wearing their masks, but the dentist and the hygienist and the dental assistants will all be wearing masks. And so I think you want to get them used to that. You want to ease them into it. This is not something where you have to jump right in and do a lot of things. This is a kind of a step-by-step easy process. And probably the most critical thing is the parents reinforcing the fact that it's fun, that there's nothing hard about it, it doesn't hurt. The more you can do to that for a child to prepare them for that, the easier the situation becomes. And then if they're a little fearful, honestly, having them sit in their mom's lap while you're doing some of that basic cleaning, you're not doing anything that's of any dramatic effect. So you're really just running a little the hand piece, which is a lot of people call it a drill, but it's a hand piece that has a little rubber cup on it. You're just rubbing it around on the teeth, and you can do that. The other thing is that as children get a little bit older, say 3 to 4, try migrating away from like the normal handheld toothbrush and try move more into a battery powered toothbrush that runs just like a dental toothbrush runs. So that gets them a little bit more accommodated to the feel of that hand piece in their mouth.
Good to know. Well, last question for you. Let's talk about what kids consume. So they're drinking sugary drinks, they're eating candy. Should parents limit? I mean, I kind of already know that you should limit the intake of sugar, but when it comes to your teeth, what do parents need to know?
Let's start with the first thing about that. You talk about sugary drinks. There's no reason for a 3-year-old to have sugary drinks. There's no reason for a 6-year-old to have, well, there's obviously no reason for anybody to have a sugary drink, to be very frank with you. But let's be realistic and know that's going to happen. You find more and more people now, and over the last 20 years, certainly drinking water is a more common thing when people even go out to dinner. I see young people that'll order water instead of like a Coke or things that we used to think about. That's really the thing that we ought to always keep in mind. I find a lot of homes, that's what the children drink. They drink water. Now, remember, there's a couple of advantages of water. Everybody needs water. You got to have water. It's very important. You don't have enough water and you will die. So those are things that are very important. But I think not changing routines and using water as not only just a health drink, but also to get them to accommodate to drinking with their meals. That's really advantageous. The other thing water does, if you really think about it, is the way decay starts is it has to have some sugar base. So there has to be something for the bacteria in your mouth to use to eat, to basically create a hole in a tooth. If you're using water, you're drinking water, it not only is it good for you, but it also washes your teeth. So there's a certain amount of cleaning effect that comes with just drinking water.
A lot of great information for parents there and for kids to know. So again, Dr. Phil Wenk with us. He's the CEO of Delta Dental of Tennessee. Thank you again for your time.